Are you sexually active? Have you given or receiving oral sex? Are you involved in anal sex? When was the last time you got a sexual health checkup? It is easy to get infected with sexually transmitted disease, but it's even easier to get tests and prevent them.
Let's talk about sex, baby. Let's talk about you and me.
What is the main difference between STI and STDs?
Okay, well, STI stands for sexually transmitted infection, and STD stands for sexually transmitted disease. So infection causes disease. So it's possible to have an infection without actually having a disease. And the aim of sexual health screening is to try and identify some of the infections before they cause serious disease. Probably the commonest one is chlamydia, which probably many people will know about. Gonorrhea is probably the second one, and syphilis. And of course the major one that we really worry about a lot is HIV. Some things like chlamydia and gonorrhea may show symptoms within a few days or up to a few weeks. HIV, hepatitis B, and syphilis may not show any symptoms at all or may be difficult to detect. Syphilis, you often get a lesion or something appearing on the genital area, but sometimes people don't notice them, particularly in women. They can be hidden in the vagina. That's why regular screening is important. Yeah, look, it's less likely than if you're having penetrative sex. There can be leakage of fluids both ways and transmission that way. What we've got to remember is that a lot of these infections are transmitted because there's micro-trauma during sexual activity. Anything that could be transmitted through any penetrative form of sex can be transmitted orally as well. The common ones would be tonsillitis due to gonorrhea or a chlamydial infection, so a throat infection basically. Usually just a short course of antibiotics is all that's required. If an individual doesn't want to do it, somebody who's got the infection, he can give permission to somebody else to do it. And also we've got to contact trace these to follow up all the sexual partners who might have been at risk. There's no easy way to do it other than just be upfront about it. Okay, so when you come for STI screening, you may be asked to provide some samples, and these might be in the forms of swabs being taken from certain areas or urine tests being done. So the areas that get swabbed most commonly would be the vagina in females, the penis in males, and the anus in either sex, depending on what type of sex you've been having. We also might test your urine. Now, both the swabs and the urines are usually tested for chlamydia and gonorrhea. To test for other sexually transmitted diseases, HIV, hepatitis B, and syphilis, a blood test will be needed. This is the same sort of blood test you would have done for anything that your doctor's sending you to be tested for. It's just a small scratch in the arm, and it's usually minor trauma, nothing to worry about and nothing to put off coming for sexually transmitted infection screening. The most practical effective form of protection is the condom, but even that's not 100% effective. Condoms can break, leak, come off during sex. Probably the best form of protection is no sex, but allowing for the fact that that's not always a practical proposition. If both partners know they don't have an infection and remain monogamous, i.e. they just have sex with each other, then there is no risk of transmission of infections.
Let's talk about sex, baby.
If you're involved in high-risk sex, it's recommended to get tested every 3 months. This is not only beneficial for you, it is also beneficial for your partner or partners. There is no shame of having an STI. Just talk it with your partner and seek help. Here are the closest places on campus that can help you with this. And remember, cover your stump before you hump.